What we're committed to in building this great new pavilion is really having something that's both staff-centered and patient-centered. And we really want to be the most important new hospital pavilion in the country.
The project in and of itself is to relocate a large percentage of the inpatient infrastructure, so beds, interventional and operating suites, the emergency department, and then the support services that go along with all of that.
Penn is a fantastic organization. The fact that they are taking their complex hospital today and trying to plan for it for the next 50 to 100 years is inspirational, because a lot of facilities today are not doing that.
IPD is a mechanism of project delivery that Penn Medicine has opted to utilize because it really brings about all of the best minds in the entire project delivery process.
IDP is a very interesting concept. It stands for Integrated Project Delivery. We work with the hospital in developing this program. We focus predominantly on taking all those complex aspects and tying it together to serve the needs of the actual hospital entity.
Building a mock-up is really great. I'm a nurse by background, and I know that many staff just don't visualize three-dimensionally.
So often when you construct something, you come up with various things that you think are going to work, but then when you're actually in the space, you say, wow, why did we design it this way? Oh yeah, it looked good on paper.
To be able to build a full-scale mock-up like is happening here with the Penn First team and this unit is awesome. It's really giving them an opportunity to really experience it and to really test those simulations in a much better environment than we can with just imagining the rooms.
Having all of us who are actually going to be working in the space, rather than just the designers or the people who think, oh, this might work, having us all involved is key.
From a design perspective, we're always really striving to create the greatest user experience we really can. I think that's what's really interesting about this mock-up is the ability to simulate people's workflows, but at the same time we're able to simulate the experiential and qualitative qualities that you really can't get when you're just looking at a piece of paper.
We have designed into the process that there's a series of simulations for a few weeks, and then there's a couple weeks for us to assess the data that comes in, see what the implications might be, replan it, give the plans to the builder, and have them do that. So we've built that in about 3 to 4 times over the next several months.
It's remarkably different, and what's really interesting to me is how much we took into account the input that the designers received after the earlier simulations.
It's innovation personified. We've never done this before, and really no one has to this scale.
I was pleasantly surprised to hear from the team that they got a lot of feedback, and based on that feedback, they really redesigned the entire building. I was very impressed hearing that.
The fact that they listened to us, they changed the whole layout of the hospital, the design, that's huge. That was much, much, much appreciated.
The second iteration of the mock-up has incorporated the majority of the constructive feedback from the first set. So the people who are coming back are saying, wow, they listened to us, this is great. It makes a bigger impact and really helps with staff engagement and people getting more and more excited about the new patient pavilion.
The inpatient mock-up was so successful that it was decided to do one for the surgical platform as well.
We are trying to think about what the future is going to hold for medicine, nursing, physicians, and patients, and that this building will be ready for what the future brings to us in 25, 50 years.
We discovered workflows that we hadn't previously considered that were extremely important to the employees and perceived to be important to the patients and their families. And we were able to bring those ideas up and address them, and it was all because of the simulation process.
We had really great feedback. We were really impressed with how open and transparent the staff were. Hugely important for a designer to get so much feedback in such a short period of time.
It's very special when an organization can say to its care providers and staff, we heard you, your input made a difference.
I hope as a result of this, we develop a facility that's going to be innovative for the next several decades, that it's just going to be as valuable and as meaningful to the patients as it is the day that it opens.
They're excited by the changes, they're excited by the fact that they've been listened to. I think we're really on the right track, and it's Penn First. This is the place.
This project is looking to be extraordinary. We're not just designing a building, we're inventing a series of complex solutions, and we're inventing a process, and we're doing it together. There's a certain bit of magic, and everybody now is deeply believing in it.